Welcome to the Board of Health meeting for Monday, September 13th at 5 p.m. And in keeping with an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law by Governor Baker on June 16th, 2021, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To use Zoom, you will need to use the link on the agenda or download the Zoom application and create an account. You will need the webinar ID to join by phone only. While the board members and applicants will be on video and audio, public participants will join the webinar as attendee, meaning they are muted and with no video feed from them. If you do have questions, there is a Q&A function. Please state your name and address for the minutes. And with that said, Chair LeBlanc is not in attendance this evening. And there are no minutes to review from our last meeting, and there are no variances. So our first action discussion item is the update on the coronavirus.
So I have one slide prepared that I did want to show. Share the screen. That is not what you want to look at. This is what we want to look at. So is everyone seeing a chart basically of dates and case counts? Yes? Okay.
Yes.
So this is the only visual that I had to add. Right now, as you hear in the news, the coronavirus cases do continue to stay at an elevated level over what they were less than 2 months ago, or about 2 months ago. We're always looking at a number that is out of date by 5 or 6 days by the time it's even posted, and now we're looking at it into the following week. So our last closure of a time bracket would have been September the 4th. Today's the 13th. So as of September 4th, then they pull this number down from the system on the Wednesday after, so the 8th, giving time for tests to get into the system and for some clarification that needs to happen sometimes. Sometimes someone's home address is wrong and the case needs to be redistributed to another community. But as you can see, you know, as everybody knows, we've been in a elevated state. This coming week, we will receive the numbers that will reflect the 29th through the 11th. Right now, when I run that report, the number is lower than what has been. It's actually down in the low 60s, and there could be some adjustments in that. So there is hope that we are moving in a different direction, and hopefully that is a downward projection. We continue to monitor the situation and follow up on cases. One big change that is coming, that has already occurred, and another that is coming, is that the contact tracing collaborative that had been put in place at the state level to help support our efforts in contact tracing and monitoring and following and supporting people who were in either isolation or quarantine. The section that had been assigned to higher education was disbanded back in August. So as far as the cases and following contacts and dealing with the caseload at Stonehill College, we're very fortunate. We have a great relationship with them, and they are in the process of getting permissions to actually be in Maven so that they'll be able to handle a lot of the work themselves. They've brought on additional staff so that they can do the good job that we've always expected from them. but without the support from the state. So we're supporting them now in the form of our public health nurse, handling a lot of the charting and the actual work in the system that needs to be done to maintain clear records on these cases. That system is also set to sunset for our general caseload in a couple of months. The state has awarded some grant money. We applied for this grant with some of our neighboring towns and were awarded a sum to hire on our own individual. They are, Mansfield is the lead agency for that grant, and they are in the process of drafting the job description, and we will get that posted and hopefully have our own epidemiologist / contact tracer shared between the communities on board in the coming months. Other than that, as far as COVID is concerned, schools are back in session. The playbook is out there with all of the scenarios in it, a lot of information. It's constantly being updated by Superintendent Cabral, as especially the frequently asked question piece of it. But most of the information in there is a matter of what DESE has already pushed out, or what CDC has already pushed out, or what the Department of Public Health has pushed out. It's just one central location with graphics that we think make sense for our community, and with the question and answer piece that we think makes sense and reflects the concerns and the questions in our community. You may have heard bits and pieces about the test and stay program. As far as that is concerned, the school committee, the town of Easton's school department, was set to receive their liaison at the end of last week, and they're hopeful that in the next week or two, they will be able to start utilizing that program. And for anyone listening that is wondering what that program is, it is a program whereby instead of unvaccinated close contacts who are identified needing to go home, they are actually able to come to school, get a test, and if it's negative, proceed with their day as they normally would. And that's done for 5 out of 7 days, because there's an assumption that there's going to be a weekend in there. I think if there's anything else, does the board have any questions regarding COVID?
You know what? I have one. I'll throw it out there because it's a question no one wants to ask. And it's not one I expect you to be able to answer, but maybe if you can, lend some opinion on. It seems like we're trending towards mandatory vaccines. And have you heard anything for or against that?
I think it depends. I think what you're seeing in the news is it depends on the environment, and it depends on, there are private industries that have already implemented it. There is talk at the federal level that in certain scenarios, it's going to come down from the federal level as a mandate. Beyond that, there hasn't been any discussion in our DPH calls that I can recall, other than it is something that can be done. Labor councils across the board seem to agree that it is something that can be done.
It can be done at the local level. We could decide tomorrow.
I don't know what our labor council has said, but it seems as if I haven't seen anything out there saying no, that it's not a lot, not that it doesn't have many levels to it and layers to it, but it does seem like there are, places where, in environments where the powers that be, including at the federal level, are thinking that they're going to start implementing mandatory vaccines.
Okay.
Any other questions?
I got nothing.
All right, great. Moving on to the next discussion item is an arborvirus update.
So fortunately, as I knock on my desk, we have nothing to report. Again, people need to continue to be cautious. People continue to need to, follow protocols, look in your yard, eliminate standing water, do what you can to avoid letting breeding grounds perpetuate. But there are no test results available that affect our region.
Wonderful. Great. If there are no questions, next item on the agenda is 35 Mill Street, asking for permission from the board to allow for temporary housing.
So unfortunately, this homeowner, or this home had a fire in it a week or two ago. And so they're asking permission to have a temporary trailer brought on site and, be staged there while they do the renovations and fixing of the home. They estimated it'll take 6 to 9 months. So they'll tie into, they'll have power to the trailer and they'll have the wastewater go into the existing septic tank.
This is not an uncommon thing. We saw a lot of this during the polar vortex, people having to move out. So I'm happy to make a motion to accept.
Seconded. All those in favor? Zias, yes.
Mills, yes.
Great. And then last item on the agenda is a betterment application for 112 Massapoa Ave.
Yeah, so the homeowner is seeking the $45,000 to repair their existing septic system, which is in failure. They're in good standing with the town in terms of their bills and invoices, and that's it.
Motion to accept betterment application for 112 Massapoa.
Seconded. All those in favor? Zias, yes.
Mills, yes.
Excellent.
So just as a side note, as far as the betterment program is concerned, this will bring us to 154 project. I think this will be the 155th project that will be moving forward under the betterment program. Amazing resource for anybody out there who has never heard of it, anybody watching or knowing anyone with a failed septic system. We strongly encourage you to get in touch with our office regarding this kind of unique way of funding the actual repair.
Any other questions? Any attendees have any questions?
There are no questions, no one in attendance.
Great. Well, then that concludes our Board of Health meeting for Monday, September 13th at 5:13 p.m.
Motion, one of you needs to make a motion to adjourn.
Oh.
Motion to adjourn.
Seconded.
All those in
All
favor?
those in favor, Zias, yes.
Mills, yes. Asta.
Thank you all.
Thank
Bye.
you.
Good night.
Bye.